And Jen Tome has more on what help is out there for them.
Well, Liz, substance abuse affects millions of people, and it comes in all forms. In today's House Calls, Joyce Milton, a mental health and substance abuse therapist at Wing Memorial Hospital's Griswold Behavioral Health Center, joins us live via Skype. Joyce, thank you for joining us.
Thank you.
Well, over the past few years, have you seen an increase in substance abuse?
Yes, absolutely. Because of the increase in the availability of heroin, opiates, tranquilizers, and street drugs, there has definitely been an increase in substance abuse.
Do you see this increase more in adults or adolescents?
Well, it's always a problem for all ages, but mainly adolescents. There truly has been an increase. We have been seeing that.
Why do you think that is?
Well, probably because of the availability. It's very easy to get it on the street now, and it is increasing in our small community, which is a really very sad fact.
Well, in your experience, what is the best way to address this growing issue?
I think the best way is education, information, and at the Griswold Center we incorporate a lot of this help that is available for anybody who gets addicted to any kind of substances. And the best treatment that I find would be the intensive outpatient program. There are 7 addiction therapists on the addiction team, and they all work very hard to give people the knowledge of the intensive outpatient program, which keeps people together, gives them a support network, helps them to use others to stabilize in the emotional issues that they have to address while they're clean and sober, because now they're feeling and they're learning how to feel again. So we just give them a safe place 4 nights a week for 5 weeks, and then it steps down into the aftercare program, which is once a week. At that time, we're hoping that they will be hooked up in their community in AA or NA or any support system that they have, whether it be church or Smart Recovery, anything of their choice. But we find that giving them that information and being able to do that in a group setting is very, very beneficial, because they're not alone, and then other people are struggling just like they are.
So in general, how long does it take for somebody to make progress with substance abuse problems?
Yes. Our program is 5 weeks long for the phase 1 part of the program, and then we have the phase 2, which goes on another 5, 6, sometimes even 8 or 9 weeks. Some clients choose to continue with that group therapy every week. And what we find is with the group therapy or with individual therapy or with both, because everybody always has choices as to what they like best, we see a lot of progress. There are thousands of people staying clean and sober from every kind of addiction possible. It's hard work, but they do it together, they support one another, and they have a lot of support at the Griswold Center with the groups that are running there.
Well, after overcoming an addiction to heroin, for example, have you seen patients become addicted to other things like smoking or gambling or alcohol?
The sad fact is a person who is addicted to one substance is addicted to all substances. So sometimes when they let go of one, they are prone to try others, because it does affect the way one thinks, and there is some distortion in the thought process. They think because they're addicted to one that they could do another one safely, and that certainly is a distorted thought, because they cannot do any safely. Addicted to one, addicted to them all. And even if it's not a substance, people find there's something missing, and now they're feeling their feelings, and sometimes that's really hard to do. It's the first time ever that they're feeling their, and they would turn to gambling, or they might turn to eating, they might turn to shopping, so they incur a lot, or smoking cigarettes, the nicotine addiction, that would increase. So even things that they're legal and that are out there can be very harming, and it just keeps that addictive process going, because it does affect the chemicals in the brain.
Okay, well, thank you very much, Joyce, for joining us and telling us some important information about addiction and substance abuse. Well, if you have more questions about substance abuse or another medical issue, you have questions about that, email us at housecalls@cbs3springfield.com.